First of all, I'd like to point out a few things. I've learned a lot today. Thank you. My name is Jeff Elton, Jefffelton. I live in Des Moines, Iowa. Concerning SF-293 coming up next year, that will not allow people to drive under the influence of marijuana. It will not allow smoking in public places. And if we have a dispensary, there will be for nonprofit. One question for everybody to consider. What kind of government prohibits research into any drug that helps the human condition? I'll leave that up to you. And straight to the board of pharmacy, there is no need to reinvent the wheel. Scientific proof of the effect of cannabis is here and is available. It's not new, it's old. I suffer from diabetic neuropathic gastroparesis, paralyzed stomach. I also suffer from GERDs and diabetic neuropathy, all of which are greatly and safely treated with medical marijuana. The most severe disease, gastroparesis, symptoms are delayed stomach emptying, chronic nausea, vomiting, and wasting syndrome. Marinol doesn't work for me. I've tried it for years. The biggest benefit that Marinol has as a citizen of the state of Iowa is it legally allows me to have THC in my system in case I ever have to drop a UA or they take blood. Okay, and they say, you're driving under influence. No, I'm not. I'm on Marinol. You know, doesn't have the psychoactive ingredient. Even though it has THC, the psychoactive part's been removed. The most, like I said, gastroparesis is the most severe illness I have. Wasting syndrome, chronic nausea, vomiting. I've tried Marinol for years. In 2008, I lost 100 pounds over in the course of 1 year. I was able to turn that around by getting off of Marinol and onto marijuana or cannabis. Vaporized, by the way, and that's what I do, is I vaporize. Vaporized marijuana is the healthiest way to get the cannabinoids into your bloodstream. It also allows the patient a better way to titrate their dose and prevents the release of harmful chemicals like benzene and the tars and carcinogens that go along with smoking. The inhalation of marijuana vapors gives me safe, effective, and immediate relief from chronic nausea and vomiting. There is no drug in today's pharmacopoeia that can claim that. The only help my doctors can offer me, since Marinol does not work, and because Sesamet is restricted, emphasis added, to cancer patients 18 years and older suffering from chemo-related nausea only. I can get Reglan/metoclopramide, which has already been mentioned here today, and which there are active lawsuits going on right now in this country because of the damage from this drug. That's the only drug my doctors can legally offer me. As my digestive specialist handed me my Reglan prescription, he said, do not take Reglan on a regular basis, for it causes irreversible Parkinson-like shakes and tremors. This is not rare. This is a common side effect. Though rarer, it does also cause neuroleptic malignant syndrome, which is fatal. Currently, there are laws pertaining to the damages of using Reglan, as I mentioned. Therefore, a man like me, who has lifelong gastroparesis, paralyzed stomach, who suffers chronic nausea as bad, if not worse, than any chemo-related nausea, I must live and suffer and live in fear of arrest, prosecution, imprisonment, forfeiture of money, property, housing, educational and healthcare governmental benefits, just to try to control the symptoms of my lifelong disease. There is no justice in this. This is not fair. Using the benefit versus risk factor, there is no doubt that marijuana is by far safer, healthier, and more effective than any prescription drug in today's pharmacopoeia in controlling my chronic nausea, vomiting, chronic back pain, and neuropathic pain. Just compare marijuana to Reglan. To force me to go without treatment or to use Reglan is tantamount to a death sentence with torture. Is this the United States of America? It is today. But you have the opportunity to change that. Please let me and the others have safe and legal access to the only medicine that helps, medical marijuana. As a citizen of the state of Iowa, I should not have to live with violence, corruption, and loss of personal liberty. This is a quote from the alcohol prohibition days. That was simply by trying to control severe symptoms caused by my lifelong disease. I can't believe the comparisons between alcohol prohibition and cannabis prohibition. For the Board of Pharmacy to recommend a negative or give a negative recommendation and for the legislature to not pass SF 293, that would be the real crime. Thank you.